This is the session where we are going to talk about the CMS 1500, whether you call it or whether you call it as a HCFA 1500. HCFA is HCFA, HCFA, which is both the forms are the same, it's just two different names. The new name is CMS 1500, the previous one is HCFA 1500. Being said that, there are still, it's industry-wide. Many places you will hear the term as HCFA 1500 because that's a commonly term what they are using it on day-to-day basis. So even though formal name change has happened for this form, but still in the usage you will hear the old form name, which is the HCFA 1500. Now, as part of this session, we are going to talk about the entire document, or I would say a form, and the corresponding fields. So we will talk about when to use it, how to use it, sample CMS form also we will look up, and then the patient information. So these are all the different sections which we are going to study about throughout the chapter, and as it mentioned earlier, this session is not for you to memorize it. This session is moreover to guide you through the entire process and give you some gist of the entire CMS form so that when you are working as a claim analyst or a business analyst or a quality assurance analyst, you understand that to test a scenario, to write a scenario, what kind of a data setup is required. To analyze a claim, what kind of a claim will have what kind of an information, what field will be populated, what provider has to submit that. So these are the different aspects considering that this session is created. This is just the partial form. What do we see here? This is the CMS form which is being submitted by the physician. Again, when we say the CMS 1500, we are talking about the professional physician. We are not talking about the hospital because the hospital will submit the different form which we have covered as part of a different chapter. This is only for professional providers like pediatric group, specialists, individuals. We are not talking about the institution like hospitals. So this is just an overview of the form. Let's start talking about how to use it. Whether you are a claim processor, billing representative, business analyst, QA, or subject matter expert, what goes inside this form, that's what you need to understand. That's the whole purpose of talking about this chapter. Because when, as I mentioned earlier, when you are analyzing it, you need to understand what you are analyzing, what is the source of the data. And that will give you the end-to-end process to understand that how it starts by patient visiting to the physician office and patient receiving the bill, how it gets submitted to the insurance, and what information goes inside it. Let's talk about form instruction. Now, some instruction before one starts filling out the information, form must be printed on the original red form. That is number one requirement. If someone is submitting it as a paper form, it has to be in its original form. You cannot have it in a different ink. As it says, it has to be in the original red form. Must be aligned with the printer setting. It may reject it if the information is truncated due to the bad alignment. So if there is any cut on the print, lines are overlapping or any issues, it's not a proper printed document, it will be rejected. No designation is accepted for the physician like MD or anything like that. So it has to say the proper name. It doesn't have to be the title and all those things. Special character like comma, dollar signs are not used. So any special character not allowed. Upper right hand corner has to be blank. As we see here, this area in this form, see here, you see this area is blank, and that is what this area is. Any piece of information submitted by the physician will be the reason for the rejection for that particular area. Now let's talk about different sections. Box 1. So box 1, this is the full on screen what we see here. In box 1, you provide what kind of an insurance claim it is. So as I said, check the appropriate checkbox depending upon the type of the insurance applicable for the claim. So if this claim is being submitted for Medicare, check that. Medicaid, check that. TRICARE, check that. We'll talk about TRICARE. We have a dedicated chapter for that. Then you have a CHAMP PVA, check that. Group health plan, which is for the ASOs. We'll talk about what ASOs is, check that. Then you have FECA, check that. If any other, check that. Most of the population, what we have is Medicare, Medicaid, TRICARE, and here, this one. These three have a very partial population, not that big population. So these are the major areas of your insurance growth where we have most of the population covered under that. So depending upon what kind of an insurance, you cover that. Then you have insert the insured ID number from the insurance ID card. So 1A is your insurance ID card, which you can take it from the ID. Patient name, very simple, last name, first name, middle name, and that's how the sequence has to be. It has to be last name, first name, middle name, because when it will be fed into the system, and system is expected to look for last name, first name, and middle name, but you have put in as a first name, last name, middle name. That is going to create problem because system will not be able to locate your record because it's your first name and last name is swapped. Patient birth date, the format is given DD, YY. Then you have a sex, which is if it is male, check that. If it is female, check that. So this is the format. Insured name. Who is the insured name? Again, the name format is last name, first name, middle initial. If the patient is not the insured, enter the insured name in this format. So what does it mean? Who is the subscriber? That's what it means. It is not asking for the patient name. If it is a patient, it will be more kind of a patient name will be represented here. But if it is not a patient and it is a spouse or a dependent, then dependent of the spouse, whoever is submitting this form needs to, or the physician office, whoever is submitting this form, they need to add the subscriber name under that. That's why it says insured name. Patient's address. Very simple. You have a city, zip code, telephone, state, all these areas. Now what it says, enter the patient address, city, state. 2-letter abbreviations for the state. You are not being asked to put the full state name, just 2 letters, short. Zip code and the phone number, including the area code. So you cannot simply just add the phone number and take away the area code of it. You need to add the full information. Zip code, 5-digit zip code works perfectly all right. Patient relationship to insured. Is it for self, spouse, child, or other? And as we have discussed about in the member module, the others could be stepchild and the grandkid, guardian ward relationship. So depending upon what kind of a relationship with the insured, you can check that. Insured address. See, the fields are self-descriptive, but you just need to pay attention. You don't get this when you are doing the analysis. And that is the overall idea, that when you are doing the analysis, you have to pay attention to it. Now, enter the insured address. If it is same as patient, then enter same. Patient status. As it says that whichever option is applicable, just check that. So single, married, other, employed, full-time student, part-time student, depending upon what the status of the patient is, check that. Other insured name. Other insured means what? That if the individual, if the patient, if the individual person have any other insurance other than the primary insurance. So that is more kind of a coordination of benefit, which I will explain in detail. Then another insured policy or group number. So if this option is yes, and you have the other insured's name, then you need to put this information. But if this is not there, you don't have to populate this also, because other insured policy or the group number only comes into the picture when you have the other insured. Other insured's date of birth. You provide, enter the insured date of birth in the same format, again the sex, which is your male and female, and that's how we check depending upon what piece of information you have available. Employer's or school name. If you are a student, then you'll have a school name. If you are working, you will have a employer's name. So enter the insured's employer name. For Medicare claims, if a Medicare payer ID is entered in item 9D, leave blank. Otherwise, enter the carrier's claim address. So this is specific instruction you have for the Medicare claim. So for example, tomorrow you are investigating a medical claim. You know what exactly you are looking for. And that's how you can understand that Medicare, this is what the requirement is. So you can explore further, not necessarily you need to remember that, but you can explore to find out what exactly the Medicare requirement is. And if that is the Medicare claim which you are investigating and it is not going through successfully, there is some problem, this could be one of your starting points for analysis. Now, insurance plan name or the program name. Now it is talking about the secondary insurance information. For Medicare claim, if the Medicare payer ID is not known, enter Medicare plan name. So it is talking about when you have dual coverage. What do? If you have a dual coverage, you provide the secondary carrier information over here. But in case of Medicare, it says that if the Medicare payer ID is not known, you don't know that, then just enter the Medicare plan name. So just entering the Medicare plan name is going to help you understand that. Now, being said that, this is only for Medicare claims. For rest others, if you have a secondary insurance, put the secondary insurance carrier detail. Then you have the is patient condition related to employment, as you see here, current or previous. So if that illness, if the sickness, if the claim, so let's take a step back. How you translate this information? So the question is, did this sickness, is it because of the prior employment, auto accident, or any other type of accident? That's why the problem is there in the patient. If yes, you mark it appropriately, like employment-based auto accident and other accident. If not, then you mark it as no. Now, if you see for auto accident, you also have a place which states it is associated with. So you need to mention that, okay, whether it is NY, Atlanta, California, wherever that accident has happened, because you have answered as yes, you need to specify that piece of information. So as it says, if the patient condition is related to employment, mark yes if the patient condition is related to auto accident. Mark yes if the patient condition is related to any other type of accident. So this is, then you may have reserved for local use. What does it say? Anywhere you see in the form reserved for local use, just leave it blank. You don't need to fill out that information. This is for some future or some scenario based. For example, as we see 10D, generally kept blank except in Medicaid secondary situation. So if someone have a Medicaid claim, but they also have another carrier where they are insured under, it could be a COB situation, but in that case you need to provide the Medicaid secondary information over here under the 10D. Then you have the insured policy group or FECA number. Now, when we talk about, as it says, fill in the group policy number if there is one. Do not insert the individual policy number a second time. Be sure that the group number goes here. So it is talking more from the, think about if you have the individual insurance, what you're going to enter over here? Nothing, because that is not applicable to the claim for that member who have the individual insurance. This field is only applicable to the member where they are in a employer-employee relationship, where you have an employer who is offering the insurance and you have taken the insurance from them. Insured date of birth, gender, and the date has to go in the date format, which is your MMDDYY. And then based on the gender, if the patient is insured, leave blank. So that is the moreover, it's a very simple piece of information, yes, no, entire form is like that. And if you look at the EHR software, you will see these are, most of the things are auto-populated because there is a key which is set up. So the moment you identify the key field, that could be anything, maybe social security, maybe the patient control number, automatically it will pull up all the information about that particular patient. Then you have the employer name or the school name. Again, employer name if you have one. For Medicare, entered retired with the retirement date in the format of MMDDYY. Insurance plan name or the program name. It is talking about who is your primary care. Provide that information. Cigna, Aetna, whatever it is, provide that. Then you have, is there another health benefit plan? It is asking you, do you have dual coverage? See, it says, if you are marking as yes, return to and complete item 9 from A to D. Why? Because there also you cannot mark this 11D yes over here and leave 9A through D blank. Because 9A to D is related to the coordination of benefit where you have the another health benefit too. Now it says, this is moreover kind of a you are authorizing, you are signing it and accepting it, whatever piece of information you have provided is correct. Now let's read back of the form before completing and signing this form. Patient's or authorized person's signature. I authorize the release of any medical or information necessary to process this claim. I also request payment of government benefits either to myself or to the party who accept assignments below. And then you sign it. So moreover, you are accepting their terms and conditions. That's what it is. Enter the signature on the file, and the patient must sign the form to make sure that, okay, you are accepting all the, and you are abide by all these clauses in the form. Then you have the same goes here also, insured or authorized person's signature. So by signing it, you are accepting all the terms and conditions unless notified or noted or made any kind of an amendment in the master contract. Then you have date of one of these, which is your relevant to reason for treatment. So if there is a history, you will put the historical date. So it says date of current, and then illness, first symptom or injury or pregnancy. Now it is talking about what kind of an information you have based on the historical data. So let's say the patient comes back because his knee was replaced. And now after 2-3 years he is having some problems. Now the date of current would be the time why the knee was replaced. Knee would have not replaced, just the patient have some pain and then he walks into the office and the knee is replaced. No. It would have happened gradually. For example, maybe he took the appointment, visited the doctor, then doctor gave him the another follow-up time to say that, okay, why not you come back with this X-ray and all those things and lab results so that I can see and recommend the better treatment. So If that is the case, then what happens? Then the date of current would be the date when the patient visited due to this problem to the physician. It will not be the date when he did the lab work or the X-ray, the radiology, or the day he got the knee replacement done. It would be the day when he first visited the physician because of this problem. If the patient has same or similar illness, give first date. It is asking for the historical recurring date. Now also, okay. So this is your more from the historical tackling. Now then you have box number 16, which says dates patient unable to work in current occupation. So what happens? There are many instances where the employer is liable to make the payment for all the number of days employee was not able to work. That is only when employer at fault. Otherwise, it's not. So in that case, these fields plays a very big role where you have if the patient was unable to work, fill in the appropriate date. So for some reason, if therefore due to some sickness they were not able to work, the day is good here. Referring physician to another source. So if you are being referred to the specialist, when the specialist will submit this claim, he needs to fill out this number 17 because you was referred by the physician. This should be left blank, 17A, that's how it is. NPI, which is National Provider Identifier, enter the provider NPI here. Hospitalization dates related to concurrent services. What does it mean? If the patient was hospitalized during this billing period, fill in the hospitalization date. So it says that if you know the start and the end both, enter it. But if you just have the start date, then what do? You need to wait for the treatment to be completed so that the insurance can submit the claim. Sometimes what happens? They just send out the claims and the insurance will be holding that claim unless they get the final bill. What is the final bill? So if the patient was in hospital for 5 days and the claim got submitted on the first day itself, that means there are 4 more days. I gave the cutoff date as 5 days, but at that point of time on day 1, physician doesn't know or the insurance company doesn't know that how long the patient is going to be in the hospital. So what they do is they just hold the bill till the time they get the final bill for the payment so that they can calculate the number of days. Reserved for the local use, as it says, unless private pay requires use of this field. The qualifier and ID numbers, if NPI is not available, are listed in the table given with the instruction for the field 2 for I and J. So it ties back to field number 24 I and J related to NPI. Otherwise, it is going to be blank. Outside lab. If there is any involvement with the outside lab, you mark it as yes and no. Now it says mark yes or no for any purchased lab test billed for on this claim. So if there is any claim related to the lab, on this claim, you bill it. Enter up to 4 diagnosis codes. Fill in the principal diagnosis code in number 1 and then secondary and so forth, so on. That's how you move on. So primary, secondary, tertiary, all these goes in a sequence because these are the revenue for the insurance company. And if you are not doing the revenue, capturing the revenue properly, you are not going to get the money from the state or from the government as a reimbursement for the Medicare and the Medicaid. Medicaid resubmission code. If you are resubmitting the claim to the insurance company, if you are resubmitting the claim, sorry, let me take a step back. If you as a physician office resubmitting the claim to the CMS, or to the state. Sorry, this is Medicaid we are talking. So Medicaid will be always state. So that means we are submitting the claim to the state for the reimbursement. If we do not add the original reference number, what happens every time you submit, you get a reference number. So if you do not enter the reference number, that is going to consider it as a new claim and create a new reference number for you. So you just need to make sure that you enter the reference number so that this reference number which you have entered can tie back to any other claim in the history. Prior authorization, as we have talked about this, prior authorization is nothing. Prior authorization number is a field. It is just a field which is going to be used when there is a claim for which the prior approval was required, and that procedure for which he or she is going to get treated require permission from the insurance company. And if you got the permission, you enter the prior auth number over here. Box 24 AJ, A to J. Procedure and services provided to the patient. Each area is explained below. Only 6 procedures can be submitted per claim form. So the maximum allowable limit is 6. And that 24, box number 24 from A through J, all are related to procedure. So this is how it looks. Date of service, you have a MMDDYY, MMDDYY from to. So from what date through what date your services are given to the industry, or I would say to the patient, and based on that you have captured the date. This is the broader picture you can download. So now this is talking about place of service code, where the service was rendered, place of service. Many physicians have a place of service at their private office location. Many of them have there at home. Many of them they have at a private, completely outside corporate business office or something like that. So depending upon what is there in their contract is the place of service which is authorized. So in this case, if you want to find out more about the place of service, you can go over here and you can find it out. This is just a place of service. For example, if it is 01, that means pharmacy, 11 means office, 12 means home. So depending upon what code they are using it, corresponding description you have it here. Now it is talking about 24C, which is your emergency indicator. If there is an emergency and the claim is with reference to that, that is how for that particular line that emergency will be created. Now then it comes down to the procedure code, what it is. Procedure code is nothing but why the services are billed, why somebody is billing it, and how to track all the services which are getting billed. So there has to be a standard, and that standard is your current procedural terminology, which is your CPT or HICPIC you call it as. Now these codes are used to say, for example, these are 5-digit codes which help you understand what kind of services are performed and why. Diagnosis code. What patient is diagnosed with. That's what diagnosis code is. So using number indicator 1, 2, 3, 4, match each procedure to the related diagnosis code listed in box 21. So if you try to do that, you will find some small exercise which you can put through all the 4 diagnosis codes and tell me which are the ones which you can add, which are the ones which you cannot add. Then we have the charges. Very simple. Each procedure has some charge. We just need to make sure that when we are coming out of this form, we need to make sure that we are entering the procedure code and the corresponding charges. It shouldn't be the case just the procedure code. It has to be the procedure and the charges. Now we are talking about units. Number of days, anesthesia or oxygen units, what kind of a unit are we talking here? So for example, let's say, if the patient, let me take a step back. If the patient was given the services and the patient have, let's say, some kind of a injection or some kind of anesthesia which is required for the patient to be up, that is going to be billed in terms of the anesthesia. And why is that? Because 15 minutes of knockdown is considered as 1 unit. So if someone has to be operated within 15 minutes, they are going to give 1 unit of anesthesia to make sure the person is unconscious for 15 minutes. And these are the kind of a service. The physical therapy is also a number of visits. That's how that is monitored, and that is also the your accumulator also you call it as. Then you have EPSDT, which is early periodic screening, diagnosis and treatment for Medicaid recipients, 21 years and younger. So this is kind of a preventive. This you can consider as a preventive because they are trying to more and more conscious about the family planning program. Being said that, they are trying to accommodate maximum people, but when it comes down to setting up the fixed number that how many, we don't have that number. Now we have the ID qualifier, ID number or NPI number. As it's showcased over here, these qualifiers and ID numbers may be used in fields 240I, 24I, 24J, 32B and 33B. Now 0B, state license number, 1B, which is Blue Shield provider number, 1C, Medicare provider number, 1D, Medicaid provider number, and 1G, which is for the provider UPIN, which you need to provide it. Identification of service provider, very important. How do you find that, okay, where is your service provider? How can we do that? If the information is entered over here, you will have the provider ID also, which is your rendering provider details, which you can enter it over here. Federal tax ID number, this is very simple. Every business have, every individual have a tax ID number. Patient account number. Patient account number is nothing but every patient have a file in the physician office, and every file has some numbers given to it for looking out. So what happens when the patient walks in, they are already able to find your file, find your documents with the help of these numbers, or they already have that up and running. Then you have the accept assignment. What does it mean? Place an X in the yes box to accept assignment for the claim, or no if the assignment is not accepted. See, there's a make a note of it. When we say accept assignment, that means in these type of claim, if the claim is related to accept assignment and this is marked as check, physician cannot balance bill the member for a single penny. The reason being is, by accept assignment, when this is a very good term, which if you know that and you are able to answer the question, that's a very good term. So what happens that the physician is not going to balance bill the member for a single penny, because when the claim got submitted, by checking this accept assignment as yes, provider is saying that they are going to accept only the amount which is going to be paid by the insurance company. They are not going to get paid a single penny by the member, and they cannot bill. So whatever they will receive, they will be happy. Then you have total charges. The total charge is nothing but your balance for the bill. Then your amount paid, which is your co-pay, co-insurance, deductible, everything is your amount paid. Balance due, leave it blank. Then again the signature. The signature over here is the provider's signature, not I'm the supplier if there is a middleman. But here we are talking about the provider who is dealing with the insurance company. In this case, provider's signature is required, making sure that the provider is signing it. Then you have the service facility location information. We are trying to find out what was the facility, what was the hospital, what was the urgent care where the service was performed. Then you have 32A, which is for NPI, 32B is for the proper qualifier. Now the billing provider information and phone number. The telephone number will go on line 4. Use no hyphen or space within the telephone number. Use hyphen only for 9-digit zip code. So only a zip code field is going to allow that. Okay. So this is up to the field number 30.